Welcome back to the Nursing Post podcast, All Nursing All the Time with Ashley and Rosa. In today's episode, we are going to discuss oral health and its effects on the body. Our goal is always to inform and spark conversation.
So I've heard people say that the way to tell someone's overall health and wealth is by the condition of their teeth. And as a nurse, I think that's pretty true.
I agree.
I think that's a pretty true statement. There are currently so many Americans that can't already afford like regular health care because they don't necessarily meet the guidelines for Medicaid. And in Virginia, we have something that's kind of like in between called FAMOUS. It's like, for families and children, they make too much to qualify for Medicaid, but can't necessarily afford private health care on their own.
But you still have to qualify for FAMOUS.
Yes, you do. It is also like income based and you have to meet certain requirements as well. The issue is that we as nurses know how important oral care is to our overall general health.
Mm-hmm.
Why isn't it included in healthcare insurance? Why is it separated from normal health insurance to where you have to purchase a separate plan for dental care? And if we can't already afford health care insurance, what makes people think that they're going to be able to pay for dental insurance on top of not having regular insurance?
Yeah, you're just not. That's why I think a lot of people are in the situation that they're in. And, healthcare spending has been down for the last couple of years because of the pandemic. Surprise, surprise. And we have mentioned this a couple of times, and apparently dentists and hygienists were not seen as essential during the beginning of the pandemic. And so, a lot of people couldn't afford to pay their copays because they weren't working. So all this stuff starts to accumulate into, your basic necessities or what's met, not the insurance that you have that you're going to need in 6 months to get your cleaning. But we do have some statistics. I do think that the pandemic has skewed some of these.
I think so too. I don't think we'll ever have accurate depiction of statistics for the last 2 years.
No, and it's going to affect like the 10-year statistics and all that. You're going to see. It's going to be interesting to look at the graphs. But the national dental expenditure decreased by 1.8% from $145 billion in 2009 to $142.4 billion in 2020. There are 3 oral conditions that affect your overall health the most, and they are cavities, gum disease, and tooth loss. About 40% of adults with low income or no private health insurance have untreated cavities. That's a lot. That's almost half the population.
It is. Low income or uninsured adults are twice as likely to have 1 to 3 untreated cavities and 3 times as likely to have 4 or more untreated cavities as adults with higher incomes or private insurance. Based on data from 2011 to 2016, children aged 2 to 5 years, about 33% were Mexican American, 28 were Black children, and they had cavities in their primary teeth. And that's compared to 18% of white children. For children aged 12 to 19, which is nearly 70% of Mexican children, have had cavities in their permanent teeth compared to the 54% of white children. Children aged 2 to 5 years, 17% of them were from low-income households and have untreated cavities in their primary teeth. 3 times the percent of children from higher income households. And children between ages of 12 and 19, which is 23% of the children from low-income families, have untreated cavities in their permanent teeth, which is twice the amount of children from higher income households. And nearly twice as many Black or Mexican adults have untreated cavities compared to those of white adults. Look at those are really big disparities there. Like, they're huge.
They are. And I was thinking when I was reading those, I wonder if part of that, with low income families, they're not eating as the most nutritious foods. They're eating the cheaper foods, and those are not necessarily as good for your teeth. So it's not necessarily, brushing that's an issue. People are like, oh, well, toothpaste, you can get for $1. Well, yeah. However, but if their diet isn't as good, then that's going to affect their teeth.
I'm glad you mentioned that, because it's not just brushing your teeth, flossing, all the stuff they tell you to do. Some of it's hereditary. Like, maybe you just don't have good genes. Okay. That would be me too. Like, my mom, she was wearing dentures by a certain age. My dad was wearing dentures by a certain age. And it wasn't because, they weren't maintaining their teeth. They were. It was just, unfortunately for them, genetics. But yeah. Like, there are other factors. It's not like somebody just decided one day, I'm never going to brush my teeth and F the dental system,
That's not
it's not like that.
In nursing school, we are required to take a nutrition class. Every nursing student has taken a nutrition class. And we remember reading in our textbooks, nutrition and digestion, it starts in the mouth with chewing. And we all know this. Anybody who eats understands this. You can't swallow your food whole necessarily. You have to chew it to be able to get it down into your stomach. And it's kind of interesting that they talk about the importance of chewing your food and how that aids in digestion. Like, I remember that, but we never talk about oral care at all.
Like, what you're putting into your body and how that affects the outcome of your teeth.
Right. Like, calcium is important for your teeth. And that's about, I think, the gist of anything that I've ever gotten when it comes to, oral care, nutrition, health. And the American Dental Association recommends that you brush your teeth twice a day with a fluoride toothpaste, clean daily between teeth, which means you're flossing. They eat a healthy diet that limits sugars, especially like the sugary beverages and snacks, and that you see a dentist regularly. So that, preventative care, we've talked about that 1,000 times. And I think probably a lot of us can follow all, if not most of these recommendations above. Like Rosa was saying, hereditary plays an important part of that. And if you're not following those recommendations, that you are increased risk for cavities and gum disease, decay, tooth loss, all the above.
Oh, and you might have like a health condition that might cause damage to your teeth, or maybe it's a medication you're taking, because there are some medications that can cause like tooth decay and loss. So,
or yellowing, like I know some cancer treatments do that.
I don't want there to be like a stigma on people that are maybe like missing a tooth or two or whatever, and people thinking, oh, well, that's because they were just disgusting and didn't brush their teeth, because that's just not necessarily the case at all.
Well, I mean, I know I have battled 2 cavities in my mouth for the last 15 years, and I got both of them, one during my first pregnancy and one during my second pregnancy.
And we know as nurses and women that, I hate to say this, but being pregnant, it's like a parasite sucking the life out of you, like even down to your teeth. Yeah. So that's why it's so important to make sure you're having that like healthy diet and you're kind of like staying away from the sugar, because after your baby teeth, we all know these are the only teeth that we get.
And having a cavity in your baby teeth can actually directly affect your adult teeth.
Exactly.
Or permanent teeth.
Mm-hmm. There are some health concerns when, you don't follow the recommendations, or like we mentioned, you have hereditary issues or medical issues. And untreated oral disease has a large impact on the quality of life and productivity. There's over 34 million school hours that were lost in the United States in 2008 because of unplanned urgent dental care. So it's like you knew you had pain in that tooth, you knew it was probably a cavity, maybe you couldn't have afforded, to have it filled or maybe have a root canal done. So you didn't go to seek treatment, and now you're having to have that sucker pulled out. So you're missing time from school or from work. Over 45 billion has been lost in productivity in the United States each year because of it being untreated. And nearly 18% of all working age adults, 29% of those with lower incomes report that the appearance of their mouth and teeth actually affect their ability to interview for a job, because they're so self-conscious, because people, like I said, people judge that.
They do.
The first thing people see, is your face and that smile. And you can imagine if you're in an interview and you never smile, what that employer in the back of their head is like. Are they a negative Nancy? Are they a Debbie Downer? You know what I mean?
Right. And they just are, a lot of people are just too embarrassed to say anything.
Mm-hmm.
If we get kind of into like oral care 101, one of the biggest things people need to understand is a cavity and what it is. And so it's literally a hole in your tooth, and they can form in many places, but they are often on the tops of your teeth where you're biting and where food gets stuck. And in the early stages, it can actually look like a white spot, which can be healed. And then over time, they turn brown or black, and they can be really, really small, or they can literally grow and open to the size of your tooth. And cavities that are not fixed will cause sensitivity, pain, infection, and you can even lose your tooth or the teeth surrounding it as well, depending upon what's going on.
And I think worst case scenario, like you can go septic from a tooth infection.
Yes.
If it's not treated. And I think that's very important that we mention that, because a lot of people don't realize the importance of your mouth, period. Like if you get an infection, let's say tonsil, whatever, it can affect your heart like directly. And so you have to be very careful. Yeah. So you need to make sure that if you are having an infection, that red soreness, the pain, maybe a little bit of pus, I don't know, to each its own. We all present different. But you can
abscesses.
Yeah. Exactly. Like you need to seek medical attention. Like even your primary doctor will give you an antibiotic for an infection in your mouth until you can get in to see a dentist. So
yes.
Please know that you can get sepsis from an infected tooth.
You want to do everything that you can to, decrease your risk of a cavity. So, try to brush your teeth twice a day, try to floss once a day, and you'll just want to make sure that you try to limit things, like we talked about before, those sugary drinks, snacks, sugary snacks. One of the big things that I think that people don't understand is the reason that you actually go to the dentist is for them to help remove like plaque and tartar buildup. Even if you brush twice a day, you're still accumulating plaque and tartar buildup. And that's the stuff that they're like scraping on your teeth and you're like, oh my gosh, they're going to rip my tooth off kind of thing. Like I have excessive plaque buildup on my back two teeth on the top. I always have. It doesn't matter if I go every 6 months, I can feel it building up. And she's like, oh yeah, well, a lot of people do. There and actually in the front lower part of their mouth is the two main places that people have a lot of plaque buildup. And so that plaque is acidic and it literally eats away at the enamel of your teeth. So that's why it's important to go to the dentist for those regular checkups. So you're at increased risk for cavities, again, if you're snacking between meals, eating sugary foods and drinks, you have a personal or a family history of cavities, if you have a cracked or a chip in your tooth or teeth, if you take medications that cause dry mouth, or if you've had head or neck radiation therapy. And so I want to touch real quickly on like the medicines that cause dry mouth. I have 2 children. I have one child who I've have zero issues with, especially when it comes, never had a bad checkup, always brushes her teeth well, does a great job. And then I have another one. I have spent thousands of dollars in their mouth. And the one that I spent thousands of dollars with has asthma and takes medicines that dry out their mouth. And I remember talking to the dentist going, like, they eat the same types of food. Like, we have the same food. It's the same household. I'm making sure that the teeth are getting brushed. We have electric toothbrush. Like, I have a thing. I'm like, it's brush your teeth and mouthwash in the morning and brush your teeth and floss at night. Like, that's what we do in our house. The kids are doing the same thing. Like, why am I battling cavities on one child and have no issues on the other? And they were like, inhalers and medicine. That's why. It dries out the teeth, and saliva is a protective coating to those teeth, and they're more prone to cavities. And oh my word, it's a pain in the butt. Like, I did not realize how much that did impact your oral care until I've had to pay for it.
Like you said, digestion starts in the mouth, and saliva is part of that. It's not just your teeth. It's the amount of saliva too.
Mm-hmm.
So cavities can be treated, but they need to be treated by a dentist. And of course, the earlier it's caught, the easier and less expensive it is to correct.
Yes.
So in the early stages, it can be repaired with fluoride. If it's deeper, the only fix is for the dentist to remove the cavity and fill the area with either a silver or white colored material. That's so you don't have a hole in your mouth after they take the cavity out. And, if the cavity is large enough, you're looking at maybe a root canal or even possible extraction of your tooth. So the earlier it's caught, the less expensive it's going to be in the long run. The other condition that's associated that we talked about was gum disease, and that's an infection of the tissues that surround and support your teeth. And it's also, a major cause of tooth loss in adults. Some of the warning signs and that can signal like, ooh, maybe I have gum disease, is that your gums bleed easily. They're red, swollen, and tender. You can actually see where your gums have pulled away from the teeth. You might have persistent bad breath or a bad taste in your mouth. And you can see your permanent teeth are loosening or separating. Any change in the way that your teeth fit when you bite, that should definitely be a warning sign. And any change in the fit of partial dentures. So if you've already lost a couple of teeth and they were giving you a bridge or a partial dentures and those aren't fitting correctly, you need to go back and see your dentist. Mm-hmm. Some people are at an increased risk of developing gum disease, and that's pretty much from poor oral hygiene. Acid reflux is a big one. That acid that Ashley was talking about earlier, that really eats at the enamel of your gums and your teeth. So you want to just make sure, that if you do have acid reflux, that you're treating that. Those medications are over the counter, but you should always talk to your physician before you start a new medication or come off of one. You're at greater risk if you are smoking or chewing tobacco. We've already talked about genetics. Crooked teeth that are hard to keep clean, that can set you up for failure, especially if you have several of them that are not aligned properly, so the toothbrush can't really do its job, and flossing is 10 times harder. Pregnancy, which we already talked about, those little parasites just sucking the life out of you, literally. Diabetes, medications that include steroids, some anti-epilepsy drugs, cancer therapy drugs, calcium channel blockers, oral contraceptives, anything that its effect is to dry, even allergy medicine I would include in here, because its whole entire job is to dry you out. Overactive bladder medicine I would even stick in here, because its whole entire job is to dry you up so that you don't go to the bathroom frequently. Advanced gum disease is called periodontitis, and chronic periodontitis affects 47.2% of adults over 30, and that's just in the United States. And it can lead to loss of tissue and bone that support the teeth, and it can become more severe over time. Tooth
I didn't realize it
decay.
was that many, it affected that many people.
Well,
That's kind of amazing. Like when I went to the dentist the other day, they told me that I was starting to have trouble with like gum loss, and I know that's a big issue in my family. Like that's a hereditary
yeah.
thing that I have, and it's not like at a point where I need to do anything about it. They just told me not to be so rough with my brushing.
Yeah, I remember we had that conversation, and I'm like, yeah, I'm probably hella hard on my teeth too, because in my mind, I'm like, I have to get the plaque off. I have to get the the plaque.
Yeah,
Because everybody wants their teeth to be like pearly white because the commercial says they have to be. But, sometimes that's not the case. And to be honest, like, I just need to get over that, because all the coffee that I drank, they're never going to be pearly. You know what I'm saying?
girl,
And I know there's a lot of stuff out there that, you can do to whiten your teeth, but that also affects the enamel.
Yep.
And so to me, it's not worth it. You know what I mean? Tooth decay and eventually loss happens when all of the above go untreated. So you just want to make sure that you're doing the best that you can do, and you're seeking medical attention from a dentist when possible. And if you have any signs or symptoms of an infection, that you're at least seeing your PCP so that you can be treated at least for the infection.
I've always had, I guess, a pull toward like insurance and cost and things. Rosa knows me very well.
Mm-hmm.
I believe if you pay for insurance, you shouldn't have to like try to negotiate bills and money to pay for the services that you need. So it was interesting to see like who has dental insurance, and this is in the United States, but there are many Americans who do not have dental insurance. The most affected population is seniors. 70% of seniors do not have dental insurance. And that then goes down to 40% of adults 21 to 64 do not have dental insurance. And then lastly, children, anybody under age of 17, 22% of them do not have insurance. So it's kind of surprising
It's eye-opening.
to see that. Yeah.
Yeah.
I'm glad that we're starting young, but I mean, just because you're a senior doesn't mean that you don't need to have dental coverage necessarily.
Well, see, it's the issue in which prior you have to pay separately for it. And if you're a senior citizen and you're on a budget, you're already probably paying for Medicare, because that's not free.
Yeah.
Medicare is not free.
No.
And then you have to go on your own, as difficult as it already is to pick a Medicare supplement and pay for Medicare. Then you have to go out and find dental insurance.
Yeah.
Which is a cost.
Yep.
When you're already on a budget. And
so I looked up, I'm like, what is the average cost of dental insurance? And from what I could find, it was $15 to $50 a month. And I kind of paused about that because something didn't seem right. Like, I know that is accurate for what I pay for dental insurance for my family. But that is when it's included through a commercial program through a job. And so it's not like if you go to, Anthem Dental or Delta Dental or, any of those big places that have their dental things. If you go to their website and just pull up like a dental plan that you want to pay for privately, it is not $15 to $50. It is hundreds. And I'm like,
it gets to be pretty expensive.
So this $15 to $50 is if it's an add-on plan to your insurance plan that you have to work.
Mm-hmm.
Not if it's an independent thing. Now, I didn't go and do like hours of research on dental plans, but I found that to be interesting because it was a little misleading in the articles that I found. And for the majority of people, I'd say $15 to $50 a month for family coverage. Of course, you're looking at the higher side for family, lower side if you're an individual. That's not bad. That's not bad. I mean, the way it's going right now, $15 gets you 2 drinks at Starbucks. And a lot of people will drink that down in a second and pay for it in a
Absolutely.
second. With that, last year in 2021, was the first time, and this was in Virginia. So if it's specific, I don't know about specific states, but in Virginia, Medicaid, if you have full Medicaid, which is different than a partial Medicaid, if you have full Medicaid, they actually now say you're eligible for dental care as well. That was literally last year.
Says a lot.
So I'm like, okay, well, that's great. So if you're working and you can afford the $15 to $50 a month in addition to your health care, that's great. And if you have Medicaid, then you're in a good spot. Medicaid's covered kids for years, but once you turned 18 or 17, 18, it was like, sorry. Or if you lost your Medicaid, sorry.
Mm-hmm. You weren't covered.
You weren't
But
covered.
I'm curious to see what Medicaid covers for their dental care.
It's like basic crowns, root canals, fill-ins, like your x-rays, your preventative stuff.
So just like regular health insurance then.
Yeah.
I mean, like regular dental insurance.
Yeah. Mm-hmm. You know, the next thing I thought of, well, like, it's great that we did offer it to them, but like, are there dentists that are actually going to accept Medicaid patients? That was my other thought. And I know that sounds really bad, but finding a dentist now is already hard enough.
Exactly.
But I will say, I think with my reading, they've had Medicaid sent out like a correspondence saying that, hey, they're accepting, because the reimbursement is not as good as commercial, which that's the way it is with everything. But they have gotten really good feedback from dentistry offices saying, yes, they will accept Medicaid patients. So I thought that was really nice. It wasn't 100%, but you're never going to get that anyways. But I thought it was a really good amount of people that had wrote back or had surveyed in saying, yeah, they would start seeing Medicaid patients. Because I think a lot of the dentist offices that I've ever been to have always been cognitive of cost and understanding. So I found that to be nice. But it really does leave out the middle person, that person that makes too much to qualify for government assistance.
Yeah.
It really doesn't make enough to be spending hundreds of dollars between healthcare and dental and vision and everything else. So we were still stuck in that like hard spot. And the Affordable Care Act did a really good job of getting dental care for children, but really sucked really bad with adults.
I think this is the problem. Everybody's healthcare, and they've separated dental from that.
It should be one thing.
Exactly. I feel like it should be one thing. And because it's separated, I think people sometimes forget that it's there and it needs just as much attention as health insurance and healthcare.
And
because it is health. It's health, period. Your mouth is part of your body. It's not, you know what I mean? It needs coverage. So I was nosy and I decided to look for like average cost of things because I don't think people understand. Yeah, you have dental insurance. You still have a deductible and you still have copays.
And there's only so much they pay.
Exactly. And so even if you have health care and dental insurance, it still can be expensive, period. I remember one day taking my son to the emergency room and the doctor had to give him stitches. He fell at school, hit his chin on a step, and he split his chin. And my son had said something to him about oh, now I want to be like a doctor when I grow up. When the doctor turned to me and said, you'll be better off being a lawyer or a dentist, I was kind of like, I was like, really? He was like, yeah. He said, if I had it to do all over again, I would have been a lawyer or a dentist. And now I see why. Because after I researched the cost of things, I'm like, dentists are making bank.
Mm-hmm.
They're making bank. So generally, when you have dental insurance, you have preventative services that are included in your insurance after your deductible is paid. Just like with health insurance, you pay the deductible and then it kicks in. What's included are your basic cleaning and polishing, which is twice a year or every 6 months.
Mm-hmm.
Out of pocket, that can cost anywhere from $75 to $200. And then, of course, you have that panoramic dental x-ray. You get one a year, and that can cost anywhere from $100 to $200.
Yep.
So basic fillings, $50 to $250, and that just depends on the size of the cavity they're having to remove and how much filling and material of filling that they're using to put back in your tooth. A tooth extraction can be anywhere from $75 to $800, depending on size and location and how difficult it is to actually extract it from your mouth. And a root canal can cost anywhere from $600 to $1,400, depending on the location of your tooth. And your front teeth are less expensive than those in the back because the dentist can get right to it and, like pull it out, no problem. Not so nice for your smile, nice for the dentist. You know what I mean?
Yep.
That back teeth, your wisdom teeth, like those are back there. They take work and they cost. They're going to cost, period. And then if you have to have any major services, we're talking about bridges, crowns, dentures, implants, the minimum amount is $500 and the most that you can spend is $4,000. I mean, that's a lot. So then it takes me back to the doctor, lawyer, dentist, lawyer, dentist.
And I'm going to tell you, dentists have a lot better hours than doctors.
Oh,
I mean, they are doctors, but I mean, dentists.
They're doctors of dentistry. Yeah.
So that's also another plus. I know as I've gotten older, I'm like, what are the hours? Well, what time do I got to be there?
Every now and again, you'll get, if you have a really good dentist, they do emergency calls or whatever.
Yeah.
They'll meet you wherever or at their clinic or even sometimes at the general hospital because, I've seen them do that too. If you have a really good dentist, you definitely want to hold on to them. But I think people just need to understand that if digestion starts in the mouth, then we need to eat to live. Then we need to also include dental in our health care.
We do. And it's easy to say, hey, you need to see the dentist to get your teeth fixed. But the reality is there will be more adults missing at least one tooth by their 40s because of lack of dental coverage. And at most you lose your teeth, but you're still technically alive. That's okay. But there are free clinics that will help with dental services, and there are dentists who donate their time to help with community outreach. And you can find a list of our resources. They'll be in our show notes where you can find free clinics near you. There's a couple of different options, so we'll definitely link both of those so that way if you know somebody or just want to have that information to give to patients or to family members, it'll all be available on our show notes.
Which you can find at thenursingpostpodcast.com. Well, you'll find our show notes, our merchandise. You can subscribe to our podcast on your favorite platform. Please leave your thoughts and your comments, anything that you would like to hear in upcoming podcasts. And we just want to thank you guys so much for the support and for listening to the Nursing Post.